Welcome, everyone. We're so glad that you could join us today. My name is Gary Powell. I'm with the Caregiver Foundation, and it's our honor today to share our virtual support group with everyone who can join in. And today we have two very special guests with us. We have Dr. Steve Blake and Dr. Thomas Harding, both of the Maui Memory Clinic, among many other duties. Dr. Blake joined the nutritional neuroscience joined Maui Memory Clinic as the director of nutritional neuroscience. And he's worked with Hawaii Pacific Neuroscience for years and publishes a lot. I was looking over your list of publications and it's very impressive.
Did you get to the bottom?
Not quite. But he especially focuses on how nutrients affect our memory and our brains. So he's going to be sharing with us what we can do, what things it is that we can control in the consumption of food and other substances that will affect our brains. And then Dr. Thomas Harding will be joining us. He's a clinical neuropsychologist. He has worked in a number of areas and is the psychologist at the Maui Memory Clinic. He I think he's just retired from the state of Hawaii as the forensic neuropsychologist for the, I guess, not all the prisons or some of the prisons anyway. Must have been a very tough job. But now we hope he has more time to devote to keeping us all in fresh minds and healthy approaches to our own memory and the care that we need for our brains. This meeting is being recorded. We will turn the recording off when we enter the question and answer point of the presentation. And that recording will go up on our YouTube channel for anyone to view later on if they'd like to go back and look at a few things. If you have a question during the presentation, there's a chat box, and I would ask you to put that question in the chat box, and then we'll forward those to Dr. Blake and Dr. Harding. And with that confused introduction, Dr. Harding, I'm going to turn it over to you, and we really appreciate you coming and visiting with us today.
Thank you very much. It was a very nice introduction. I'm going to attempt to share screen again, and let's see how that looks. Is everyone seeing that okay?
Yes.
Good. Good. Well, thank you very much for having me today. Welcome, everyone. And today we're going to talk about unclogging your brain arteries to improve thinking. How do you do that? Well, you don't eat in excess of saturated fatty acids, which is probably more the norm in America than not. I'll be joined by Dr. Thomas Harding, who's a neuropsychologist, the director of the Maui Memory Clinic, where I am now. And on screen, you can see his book, You Can Prevent Alzheimer's Disease, and my book, Nutrients for Memory, that describes the Hawaii Dementia Prevention Trial, which was a clinical trial that I wrote and ran and was very successful using nutrients to battle dementia. And some of our team members are there just below. Let's see if the down arrow works. Nope. How about now? Yeah, that's better. So 2 studies published here might be of interest to you. One is the Hawaii Dementia Prevention Trial, a randomized trial evaluating a multifaceted nutritional intervention. That means we used lots of things to slow cognitive decline in mild cognitive impairment patients. Another one that's right on point for today that I wrote and Dr. Harding assisted me with is reducing excess dietary saturated fat intake to improve cognition in vascular dementia. We have found that when people do reduce their saturated fat intake, takes a little time, but not always that much, as you'll see. And more blood gets to the brain and gets into the little capillaries of the brain and feeds our brain cells, and we can think better. Now, you know how it feels when you're tired and hungry and it's hard to think, it's hard to remember. And that's because your brain cells are not getting the nutrition that they need, the oxygen and the glucose, blood sugar. And it's very similar to what happens when your blood vessels are clogged up in your brain. So we're going to talk about ways that we can stop, or reverse this clogging of the brain. Now, in the dementia prevention trial that I talked about, which we did on Oahu, we started with people with mild cognitive impairment. Now, this is a phrase you might want to know about. It's between normal aging and dementia. It's where people are a little more forgetful than they should be for their age, but not yet impaired. Dementia, I think the easiest definition is when you can't live life by yourself and you need help. So these people were still going okay, but they were having problems. They started, there's a test available that's real simple, that 25 to 30 is normal, 20 to 25 is mild cognitive impairment, but not dementia. And then below 20 is getting into dementia. When we first started, it was at 19, just beginning dementia. But after 3 months, it was already up to 28, normal range. Went down a little bit and then up to 29, which is very good, about as good as you can get. So it may be possible. One of the things we did was to reduce dietary saturated fats in the trial. And we did lots of other things too. If you're curious, you can read my book, Nutrients for Memory, and that will let you know what else we did. It tells you everything and you can do it yourself. drsteveblake.com is my website, and I have books for under $10 there to make them accessible. We look at the different dementia here on this graph, and on the left we have Alzheimer's disease, and on the right vascular dementia, and then in the middle mixed dementia. So dementia can be the different types. What's the involvement of saturated fats? They're directly related to vascular dementia. Vascular dementia basically means clogged up arteries, and saturated fats clog up arteries if they're in excess. And then we have mixed dementia, where the artery clogging is one part of it and the Alzheimer's plaque's another. But on the Alzheimer's side, we find that excess dietary saturated fat raises cholesterol, right? We all know that. We have our cholesterol checked to see that's not too high. I'm sure some people here are taking some medications to reduce their cholesterol. When your cholesterol is high, you form more Alzheimer's plaques. So high dietary saturated fats impact all of dementia right across the board. And we can do a lot about that. You'll see at the bottom of this slide and almost every one of my slides, a scientific study that backs up the information that I'm giving you. And you can look up these studies, look into them, find out more about any of these topics. Now, the brain can shrink over time. On the left, we see a full brain, and on the right, a brain with Alzheimer's disease that has shrunk. And you see there's openings, like holes in the brain, that make it look like it's not working well. And on the bottom, these are PET scans, and they show glucose activity. Glucose is the main fuel for the brain. So if you see red or yellow, you know that part of the brain is working. And if you don't see red or yellow, then you know those parts of the brain are not working. When you compare the left and the right, you see that in Alzheimer's disease, the oxygen, the glucose are just not getting to the cells so that they can do their job. In fact, in advanced Alzheimer's disease, they can't even do their job in controlling the autonomic functions of the body. And that is one way people can die from Alzheimer's disease. So we want to prevent this. The good news is it is reversible. And that's pretty exciting. Many researchers have found that when people change their diet, reduce their dietary saturated fat, the American Heart Association has a goal of under 6% of calories. That translates to about 12 grams on a typical 1,800 calorie diet. So if you can get your dietary saturated fat down to 12 grams or less, then you'll be losing the cholesterol and plaque that clog the arteries rather than building it. And this has certainly happened. I've seen images of arteries that were clogged up and they've become unclogged The other good part about reducing saturated fat in your diet is that it's not just memory and thinking ability we're talking about. This directly raises your risk of the #1 killer in America, heart attacks, and the #2 worldwide and #3 killer in America, strokes. And strokes can be terrible. Sometimes they're not so terrible, and sometimes they're terrible, and sometimes they're deadly, and something to be avoided. So you can kind of do 3 things with one dietary change. Now, it's not so easy because some of our favorite foods like cheese have a lot of saturated fat. Meat's also famous for saturated fat. Surprisingly to some people, coconut oil is loaded with saturated fats. Now, Dr. Harding is going to explain how clogged vessels from excess dietary saturated fats damage our brains. Is Dr. Harding in attendance yet?
Yes, I'm here.
Oh, excellent. Just let me know when to go down the slides, please.
Okay. All right. So let's just go to the next slide, please. Okay. So just so everybody gets a quick glimpse of a healthy brain versus a brain with dementia. This is Alzheimer's, but a brain with cerebral vascular disease looks very similar. So on the left side, now this is a coronal section. So if you were to cut the front of my face off from my ear to ear and just sort of slide it to one side, we call that a coronal section. So at the bottom of that your spinal cord would be going down there. At the top, that's the top of your head. So the first thing you can tell of these two brains is, one looks healthy, nice and plump like a grape. And then the one that has shrunken looks like a raisin. That's a simple way to compare these two is the one that has shrunk. If you go to someone like me or a neurologist and they're saying, well, you have brain atrophy, what they're talking about is that shrinkage that you see there. Now, the reason why it shrunk, if you look at the Alzheimer's brain, you can see there's quite a few holes in there. And down there at the bottom, there's an oblong hole. Dr. Blake, if you move your mouse around, does it show up on the screen?
Yes. Here.
Yeah, put it up near the hippocampus, up towards the right, just a little bit down. That's the ventricle. No, over here towards the temporal lobe to your right.
Over here?
Oh, and then down one. Down that hole right there. See that? And you compare that to the other side, it's full of what's called the hippocampus. Now that hippocampus in Alzheimer's disease, as you can see, it's gone. That's the reason why somebody that has Alzheimer's will ask the same question 5 minutes later, because those brain cells are gone. So they're not doing it to frustrate the caregiver. They're doing it because the brain cells responsible to hold on to that information are gone. And we can see that very similar with small vessel ischemia. Dr. Blake, please go to the next slide. Okay. So what we have here is, again, this is a coronal section. And you'll see arrows pointing to certain things. And the first thing that pops out when I see this is a lot of spots that look like black pepper. Okay, those black pepper spots are small little infarcts that start accumulating in your brain. Surprisingly, in your mid-40s, middle age is when this process can begin if you have high cholesterol, high plaque in your diet, hypertension or high blood pressure, right? For those of us that have stressful jobs, you have to be mindful of these things, or else we can start having these spots. And some of those arrows that they're pointing at are kind of large. Those are areas that don't really work anymore. It's just scarring, and it just is not working. And as you can see in this picture that's got vascular disease, that place where the hippocampus on both those hemispheres is also missing. So Alzheimer's disease is not the only type of dementia that comes with memory loss. Small vessel ischemia can cost you your memory as well. Next slide, please. Okay, so how prevalent? Yeah, I mean, I put this in here just so you guys can get an idea. If you're thinking you have a pristine brain, Yeah, that's a nice thought. But what we have here is small vessel ischemia, again, starts in your middle age. It's the most prevalent brain condition. It causes about 25% of ischemic strokes, 80% of intracerebral hemorrhage. That's quite a bit. And it contributes to 45% of all dementia. So like Dr. Blake was saying earlier, a mixed dementia, Alzheimer's mixed with vascular disease. It's what I see here in the clinic more than anything. And the good news is, as Dr. Blake will tell you, is the vessel piece, you can stop it in its tracks. Next slide, please. All right, so I like this picture because it shows, if you look at the bottom there at the base where your spinal cord is or your neck would be, you got that large artery, that's called a carotid artery, and it's nice and big. But as it goes up and branches out into smaller and smaller areas, those small areas are susceptible to having a clot or a hemorrhage, especially if they're in the frontal lobe. So the frontal lobe is on the left of your screen. It's that piece, your eyeballs are sitting just underneath that ledge right there. And then the back of your brain, it's, as you can see, that's the cerebellum, but we won't go into that. Just understand that large vessels can have plaque in them that can break loose and go up into one of these smaller areas, and that's when you start having a problem. Next slide, please. Okay, so here's a good example because there's different types of strokes. So the ischemic stroke, you got this blockage. If you look at the bottom left right there, you got some plaque in an artery. And let's say down below there was an embolism that broke loose and it's stuck. And so it pretty much blocks the blood flow, which is when you start having a stroke. And then if you look up above, you can see that gray spot where there's no blood flow going. And that means the tissue, if it's not getting glucose and oxygen, it's dying, okay? And then on the right side, you have what's called a hemorrhagic stroke or a bleed. Now, those earlier slides that you saw with those little black peppers, okay? That's these little hemorrhagic strokes. They can be as small as a transient ischemic attack that will be temporary. A lacunar infarct is a little bit bigger, tends to be in the subcortical areas, basal ganglia areas. But it just grows overnight. You could have one during the night. You wouldn't even know it if it's a small one. You wouldn't feel it. Next slide, please. All right, so this was kind of what's inside an artery. Dr. Blake's going to tell you how to get rid of some of this stuff. So you can imagine, wouldn't it be nice to have a normal artery that looks nice and clean? I'm working at it. Dr. Blake is changing my diet and I'm working at it. Truth of the matter is I probably have a little bit of mild atherosclerosis if I'm completely honest, but I'm getting rid of it because I'm changing my diet. And then there's this severe atherosclerosis where, now that's a large artery. It's supposed to have a lot of blood going through it, but not much is going through it in that little space because there's all of that gunk in there. Next slide, please. So I put this one in because I wanted you to see, this is a large artery where you see lots of red blood cells coming through. And yes, there's a little bit of a plaque in here. We probably have some of that in our arteries, but blood can still get through. Now, one of those little red discs, that's a red blood cell. Okay, so that's a pretty big artery. But the next slide is going to be just big enough for one cell to get through. Next slide, please. So this is an electron microscope that is looking at this, what we call a capillary. And that little red disc that Dr. Blake is moving the mouse around, that's one red blood cell. Now imagine if it's so small that only one red blood cell can get through, what would happen if there was a little bit of fat on the side of that capillary? Okay, so, or let's say there's some plaque in there, but the brain wants some blood to go through there. It might raise the blood pressure up a little to get it through there. But either way, that area is in trouble because it's either going to have a small bleed or it's just going to stop in that small area. Now, that's a small area. It's not going, you're not going to feel that. You're not even going to know what's happened. until one day you're trying to remember somebody's name. You're going, what was that person's name? How come I can't think of that? So next slide, I'm going to show you what's going on in your language areas. Okay, so for how do brain cells communicate? So neurons work with electrical and neurochemistry to communicate. They're constantly talking to each other. And here's a neuron A, and it sends an electrical message down what we call an axon over here to B. And then at the terminals, you've got the synapse. Let's talk about, say, dopamine. Everyone's heard of dopamine and Parkinson's and stuff. So they're going to, at the synapse, they're going to communicate with dopamine, but the electrical charge is going to go down this cable. You know, think of it like electrical cord. It's got insulation around it. And so you've got insulation around this little cable that's going to go over here and talk. Next slide, please. Now, that little cable, you've got billions of these neurons in your brain. And those little electrical cables get bundled up into what we call fasciculus. And so this is the left side of your brain. Again, your nose and your eyes are on the left side, so that's the front. And so we've got in the left hemisphere is our language regions. And we've got major language regions in the front, and we've got major language regions closer to where your ear would be, right? And then you even have to have the very back of the brain when you read something that gets involved for this language. Now, in order for you to put together a sentence or talk or even hear and make sense out of words, these language regions have to be in constant communication. So they're constantly sending electrical signals back and forth, back and forth. Okay, next slide. Okay, so now this is what we call an axial view. Okay, so at the very top of the screen, that's the front of your head. So your nose would be at the top. And the back of your head's down there where it says mild, moderate, and severe. So we're looking top down on your brain. And on each, you can see two hemispheres in each side. And there's these black areas we call ventricles. That's where your cerebral spinal fluid is. But right beside that ventricle or that black area, you see these white long lines. Now, that is what is called small vessel ischemia. So those communication lines that I was showing you earlier, right? They are being disrupted. So how bad can that be? Well, all of you guys over on Oahu know what H1 is like if one lane gets closed. It goes from nice, smooth flowing traffic to, oh my God, why am I not moving? And the same thing happens in your brain. If it's got slowed processing speed, you're not going to be able to have those language regions talking quickly and in a timely manner. And that's important because if they're not in sync quick enough, you might get distracted and forget what you were doing. You might go to the refrigerator to get something from the couch, and when you get into the kitchen, you forgot already what you were in there for. So that senior moment, part of it is this processing speed that you see here. Now, mild, you can see that if someone doesn't, let's say you love sausage and cheese. I like cheese, and but I had to give it up because my cholesterol was high, and I was growing some small vessel ischemia in my brain. And then if I don't change my diet, I could very well end up in this moderate section. Now, if you look at the moderate slide, you can see these white bands are getting thicker, which means more of those communication areas are damaged, and it's starting to extend out into the cortical areas where they're talking to each other. And then severe, now I can tell you this person over here on the severe side is probably what we call aphasia. They're having a hard time talking or comprehending what's being said because the communication lines are in pretty bad shape and their processing speed is really slow. Psychomotor speed is slow. Well, why is that so important? Well, let's say you're driving a car and everyone's whizzing by you. You need to have that sufficient processing speed to keep up with what's going on around you. If some little kid jumps out in front of you on the street and you don't have quick reaction times, that's going to be a dead little kid. And I have had patients come in here and admit to me that they've hit somebody at night because they couldn't see and they couldn't react in time. And so, you know, we do the testing, and sure enough, they've got some of this vascular disease going on. Next slide. Okay, now it's not just, no, this is a pretty nice picture of a brain MRI or a magnetic resonance imaging. I included this just so you could see. It's not just, if you look at this one on the left, you can see the white matter versus the gray matter, like that first slide I showed you with the healthy versus Alzheimer's. So the white matter on this left side looks pretty good, but over here where Dr. Blake is moving his mouse, this is not just small vessel ischemia in the subcortex, but it's also hitting the cortex over here in the parietal area. And that's going to cost you visual spatial abilities and things of that nature. And then over here, there's a severe one. It shows, oh my Lord, that entire parietal, some of the temporal is moved up into the motor sensory cortex. That's a pretty bad stroke. So it definitely can happen in the subcortex and small vessels, and it can happen at large events like you're seeing here on this slide here. Next slide. And just one more to drive a point home. I showed you an earlier slide of just small little peppers, but those little peppers can get even bigger. Now, this person here has got it extensively in the cortical and subcortical. This person is in pretty bad shape. It is at a point where they've got, this is probably moderate stage dementia. This is not mild stages. They have moved on to what we call a CDR of about a 2. And they're probably, if someone's taking care of them 24/7. Okay, is that my last one, Dr. Blake?
Let's see, I think that is. Thank you very much. You really scared us all by looking at what can happen to your brain.
Well, I tell you, you scared me, and that's why I've changed my diet, so.
We call Dr. Harding the human MRI because he can test someone in the clinic and identify which part of the brain isn't working. And then when they get imaging, it proves the point that really is the area that is having trouble. So now I'm going to talk about how you can lower your excess dietary saturated fat and clear up those blood vessels that Dr. Harding showed us. But first, by the way, here's a picture of saturated fat. The French fries, the burgers, the hot dogs, that pepperoni and cheese there. Those are the very common sources of saturated fat. How does it work? Well, you see the artery up there on top that looks all yellow, that should be open and getting blood there. Have you ever heard someone, maybe an older person, talk about their carotid arteries in their neck are plugged up and their doctor says they're 70% plugged or 50% plugged or 80% plugged? This is very, very common. And this one is quite plugged, isn't it? Well, the two pictures on the top are really of the same thing, because without all that high saturated fat food, you don't get the plugged arteries. How does it work? When you reduce the dietary saturated fat, then the arterial blockage gets less, improving brain blood supply. It's very important. It's called perfusion, that the blood can penetrate into the brain, get right into the arteries, arterioles, and capillaries, go to those nerve cells that need it and allow us to think, to talk, to navigate, to remember. That's what we need. Also, reducing dietary saturated fats will reduce your risk of strokes. Tiny strokes build up, as you saw just now in real graphic detail, reducing vascular dementia if you reduce the saturated fat. So those little black peppers he was talking about, those white spots that were plugged, that's what you can do. Also, and interestingly enough, the saturated fats increase blood cholesterol, and that increases the Alzheimer's plaque in the brain. Or if you lower your saturated fats in your diet, less Alzheimer's plaque is formed in your brain. So how do you do it? to improve blood flow to the brain, reduce saturated fat. Typically, that's animal fat. The only commonly eaten fat that is high in saturated fats that's not an animal fat is coconut oil, which technically should be called coconut fat since it's solid at room temperature. Now, here's a study that was done. They took 100 students and they fed them a 30% saturated fat breakfast, and the control group got 6% saturated fat. Now, 6% is good. That's what we're looking for. That is not what they got. So it reduced their hippocampal memory. That's the thinking and memory area of the brain, 16%. Now, how long did that take? Maybe 40 years? Maybe 4 years. How about 4 months? 4 weeks? How about 4 days? It took only 4 days for this high saturated fat food, just breakfast, okay, not even all day, to reduce their memory 16%. Imagine what happens if you do this for year after year after year, which is what most people do. But you can change it. We're empowering you to make the decision, as Dr. Harding has done, and his cholesterol is looking good. That's how you can tell. If you're winning on saturated fat, your cholesterol goes down. If you're staying even, it stays the same. And if you're losing, it goes up. And that's a risk factor for, well, dementia as well as heart attacks and strokes. This was another study. This one only took 3 days. They took high saturated fat diets, and in 3 days, they impaired learning and memory. When they looked more closely, they found that the synaptic plasticity was reduced. Now, what synaptic plasticity means is you say to yourself, I'm going to go to the refrigerator and get some orange juice out. And you walk to the refrigerator. If you have good synaptic plasticity, you reach for the orange juice. If you don't, you open the refrigerator and just stand there looking blank because you didn't have enough learning ability to imprint that little short-term memory on yourself. And that can be frustrating, or in more advanced stages, really debilitating. Also, acetylcholine is needed for nerve transmission. And in 3 days, the high saturated fat diet reduced acetylcholine. Now, the most prevalent drug for treating Alzheimer's raises acetylcholine in the brain, which is a neurotransmitter in the brain. Also, dopamine, which makes you feel good, was reduced by this high saturated fat diet. Over 30 years? No, 3 days. Serotonin was reduced. And with less serotonin, we can feel more anxiety. After all, what does Prozac do? It increases your serotonin. And finally, the high saturated fat reduced brain-derived neurotrophic factor. This is something that services the brain and makes it work better. You get more brain-derived neurotrophic factor if you do exercise, and you get less if you eat a lot of saturated fat. And what do a lot of people do? They sit on the couch and eat saturated fat, okay? So I'm suggesting that you change a little bit. If you reduce saturated fat in the diet, you can improve memory and learning. And we've seen this at the Maui Memory Clinic too. In this study, lower intake of saturated fats in all stages of adulthood are associated with less Alzheimer's disease and improved cognitive performance. That's what we want. Better memory speed, overall cognition and function were noted. So people can make decisions, they can drive better, they can learn. This is what's needed. And all of this improved with reducing dietary saturated fat, such as cheese and hot dogs and beef and pork. These are usually the biggest sources. Butter is another big source of saturated fat. Regardless of what Time Magazine has to say, I prefer to read the Asian Pacific Journal of Clinical Nutrition, published in 2020, and they found that this was a big problem. In this study, they looked at high saturated fat diets, and they found that it could kill off over 50% of brain cells over time. This is not what we want. So we're going to need to learn how to eat less saturated fat in our diets. And I'll tell you something interesting. It's not just meat and cheese that has saturated fat. There's a little bit of saturated fat in most healthy foods that have any fat in them at all. Even nuts and seeds and avocados, which are truly healthy foods, have a little bit of saturated fat, and that little bit adds up over the day. So there's not a lot of room for high saturated fat food. One of the ways that saturated fats damage the brain is through microglial activation. Okay, to translate that, we have little police cells in our brain that normally walk around like a good cop on the beat, making sure there's order among the brain cells. If there's one that's in bad shape, he'll kill it off. And there's as many microglia as our brain cells. They're all over the place servicing our brain. But if they get activated by inflammatory substance like saturated fat, then they can go on a killing spree, like we hear about in the news when police get out of control and they start killing people. In this case, it's our brain cells that are being killed, and they're being killed by the microglia that are supposed to service them. So the saturated fats, normally saturated fats are found in foods like, let's say, a steak or a hamburger. With them are dead bacteria, the leftover membranes of gram-negative bacteria. You know, you kill the bacteria because it's cooked, but the leftover membranes with the saturated fat go in the bloodstream and trigger these surveillance cells, and they're called toll-like receptor 4, and they say there's inflammation, and this happens in the brain too. When it happens in the brain, they trigger the microglia to start killing brain cells. Did you notice Dr. Harding's pictures of the brains that were smaller? Those brain cells have been killed off. And this inflammatory reaction is what kills them off to a large extent, and oxidation also. This is what does it. This is what shrinks the brains. A cascade of inflammatory cytokines killing brain cells. We have interleukin-6 and toll-like, well, there's a whole list of them. Nuclear factor kappa B is a big one. Now here's a picture of the carotid artery in the neck supplying blood to the brain. They looked at patients with less clogged arteries, and they had fewer memory problems, fewer tiny strokes, and less vascular dementia. That makes sense, doesn't it? Their brains were receiving the blood that they needed to think. Patients with less clogged arteries had better performance in language and navigation and attention. So this was very important that your blood supply to the brain is there. Now, over time, in a matter of weeks, usually, you can see a difference with a diet that's reduced. Now, we counseled one man, I certainly won't mention his name, but he had 68 grams of saturated fat per day, and 12 is a maximum number. So you can imagine what his carotid arteries look like and his brain arteries look like, plugged. And he could reduce that, and we all can. And your cholesterol will tell the story, because as your cholesterol comes down with a diet lower in saturated fats, then you know that things are cleaning up instead of plugging up. They found that those with carotid clogging had 2 to 5 times the risk of severe Alzheimer's disease. So it's not just vascular dementia, it's dementia of Alzheimer's and vascular dementia. By far, the 2 biggest categories are influenced by saturated fat. Insufficient blood to the brain declined learning and memory, as well as increasing the amyloid plaques. And this they did by, in the lipid rafts in the brain cell membranes, increasing beta and gamma secretase. That's kind of a long technical story, but enough said, less saturated fat, less Alzheimer's disease. In this one, researchers followed people with clogged carotid arteries for 3 years. Patients with unclogged brain supply arteries were 4 to 15 times less likely to have cognitive deterioration. If you want to not have cognitive deterioration, 15 times less maybe, then you can clear your arteries. Now, they also put stents in some of these people, which clears up about maybe 4 to 8 inches of your blood circulation, which goes on for many miles. It's only a little bit, but even that small amount improved memory 7%, just by helping with a stent to get that blood up to the brain, to the otherwise clogged arteries, but still get some more blood up there. Have you ever heard of the paleo diet, the Paleolithic diet? It's kind of a big diet out these days. This study looked at 2 months on a paleo diet, and it reduced that brain-derived neurotrophic factor 30% and reduced cognition. Well, maybe it does make you think more like a caveman if cavemen can't think very clearly. I don't know. Diets high in saturated fats, like this paleo diet, reduce the brain-derived neurotrophic factor. So there's less learning because of less synaptic plasticity and less nerve regrowth, which is called neurogenesis. And nerve regrowth has to be happening all the time. And when you attack it with a high saturated fat diet, it doesn't happen. And so the nerves get less and less, and they start looking like those pictures that Dr. Harding showed you. Okay, what are some high saturated fat foods? Now, I know Spam is supposed to be the 5th food group in Hawaii, but half a can is 18 grams. I have to tell you, I was in Walmart one time, and this big local man was staring at a can of Spam, trying to read the saturated fat and little tiny letters on it. And he says, you know, can you help me here? And so I read it, and I said, well, half of a can has 18 grams. And he said, buy you 2 cans, how much is that? Well, already half a can is 18 grams, and 12 is your total for the entire day. Okay, you see the problem. Coconut oil is the highest, 2 tablespoons, 24 grams. Cheddar cheese is high. All cheeses are high in saturated fat. They do make alternative cheeses that don't have high saturated fat, but they're not made from cows. Fast food cheeseburger, 9 grams. That 9 grams is pretty close to your 12-gram daily limit. So you can't have too many of those in one day. Even milk, yogurt, or ice cream, 1 cup is 5 grams contributing to your daily take. Remember, 12 grams is the limit, so read the packages and you can control this. What about low saturated fat foods? What can you do? Yeah. I would like my wife to describe these low saturated fat foods for you. Here she is, Catherine Lake.
Hi, we work as a team at the Maui Memory Clinic, and I talk about the foods and how they work. So if our goal is under 12 grams of saturated fat per day, where are we going to get it? Well, you're safe with beans, nuts, seeds, vegetables, fruits, and grains. Those are safe foods, and you can get very well fed and very satisfied with those. In this, I created this slide. Vegetable curry is only 2 grams. Depending on how much coconut milk is in it, it might have up to 5 grams of coconut milk, of saturated fat in the coconut milk. Tofu is very low in sat fat at 1 gram. Silk soy milk, you're safe there, just a half a gram. Pinto beans, all the beans are very low in sat fats with 0.2 grams. So beans are very satisfying, and they cover many different nutritional bases. So you're really in good shape there. All the vegetables are very, very low. Swiss chard has none. So pretty much you can eat whole plant foods and you'll be safe and getting healthier and brighter every single day. Thank you, Steve.
Thank you, Catherine. She's very good at helping people to understand delicious ways to change their diet. And there are delicious recipes that are lower in saturated fat. You know, imagine a vegetable curry, delicious. What I do is I analyze diets using the Diet Doctor software, which I created, and I've been updating it. It now has over 292,000 food choices. So not only healthy foods, but even very unhealthy foods are included here. So you can track your saturated fat. Shown on this slide happens to be a paleo diet. Look at that calcium. It's way too low. The lower bar here shows how much calcium you should get in a day, and this is all you got on a paleo diet. The zinc was low, the magnesium and manganese were low too. And this is just one of the many analysis pages that I look at to analyze diets. The Diet Doctor is available on my website if you want to use it yourself, or you can email me and we can analyze your diet for you. And the Brain and Body Food is it's a supplement that we put in most of the things we use in the Hawaii Dementia Prevention Trial to help people think better and more clearly, mostly essential vitamins and minerals in the right forms. So these foods are the foods that are safe for saturated fat. And you see here, any vegetable, anytime. All the fruits, no problem. Whole grains, not a problem for saturated fat. Beans of all kinds, green, dried, lentils, all of those. Peanuts are a legume, not quite a bean, And you can get too much saturated fat with a lot of peanut butter, but a little bit's okay, and has vitamin E and is quite nutritious otherwise. Now, I want to go over a few slides talking about cholesterol and the risk of dementia. People with lower blood cholesterol at midlife were 2 to 3 times less likely to get Alzheimer's disease or mixed dementia. But even Alzheimer's disease is highly influenced by saturated fat and resultant cholesterol in the bloodstream. Cognitive impairment and amyloid plaque were less with lower cholesterol levels. So we counsel people, and this is not always easy to do, to reduce the dietary saturated fats to 6% of calories, so under 12 grams for an 1,800 calorie diet. If you're eating more food, then you can take a few more grams of saturated fat without creating trouble. High cholesterol impairs thinking. So when you eat too many dietary saturated fats and your blood cholesterol goes up, that can impair your cognition and increases neuroinflammation, as I mentioned. It's associated with the production of toxic amyloid beta peptides, which is Alzheimer's disease. Oxysterols are what happens when you cook cholesterol-laden food like eggs, for instance. You cook an egg, which is loaded with cholesterol, you get oxidized cholesterol. One of the problems is that this oxidized cholesterol can traverse the blood-brain barrier and go into the brain, create inflammation, and activate those microglia and start killing off brain cells, shrinking our brains. So you might want to rethink eating a lot of eggs. Eggs and shrimp are 2 of the highest cholesterol foods out there. Cooked animal fat, you get cholesterol. We break down our own excess cholesterol, and that turns into oxysterols. And then if cholesterol is eaten, like for instance, eggs don't have much in the way of antioxidants. So the cholesterol then oxidizes and becomes oxysterols in our body, what hasn't already been transformed by cooking. One other item with high blood cholesterol, which is created from excess saturated fats in the diet, atherosclerotic plaques have 20 times more cholesterol than healthy arteries, 45 times more oxysterols. And this arterial plaque laden with cholesterol can be sharp crystals that can create a blockage in the artery, resulting in vascular dementia, stroke, or heart attack. We also need vitamin E and carotenoids from colorful fruits and vegetables to slow cholesterol oxidation that is in our body. We make cholesterol in our body. You know, it's amazing. We make 70 quadrillion molecules of cholesterol every second. We do not need to eat it. It's really better if we don't. And only animal products contain cholesterol. No plant products do. Plant diets have been found to improve cognition. They have polyphenols, which are anti-inflammatory and antioxidative, vitamin C, vitamin E, and those colorful carotenoids. They reduce brain inflammation. They improve cognition and memory. And when they looked at Alzheimer's brains after people died, they found that the carotenoids like carotene and lutein were lower in the brains with Alzheimer's than in healthier brains. A plan of action. Find alternatives that'll be delicious, easy to prepare, and keep your memories safe. I have a couple of photos here by Miley Harding, who's become very good at this. Keep dietary saturated fat under 12 grams by reading the packages. And there is, for instance, alternative milks. These silk almond creamer is delicious for coffee. The silk almond drinks, that's a dark chocolate. It's pretty good. How do you like the dark chocolate silk almond milk, Dr. Harding?
It's addictive. I'm glad most of these people live on Oahu because I don't want you guys clearing out my stash over there at the store. It's very good. It's really good.
Yeah, so some of these products are the Gardein brand makes some different things that are really delicious that are kind of imitation meats, but really without the saturated fats, you're protecting your brain, but you're not suffering because they're delicious, easy to find in frozen food sections, especially in health food stores. I want to thank you for listening to this. And here are the publications. Dr. Harding's book, You Can Reverse Alzheimer's, or You Can Prevent Alzheimer's Disease. The Dementia Prevention Cookbook my wife wrote and has many recipes, makes it easy to have delicious food that's quick to prepare, that's low in saturated fat and protects your brain. And my book, Nutrients for Memory, you can follow what I did in there in the Hawaii Dementia Prevention Trial to boost your own brain power and memory. And again, the Brain and Body Food in my books are available on drsteveblake.com. And You Can Prevent Alzheimer's book and more information on MauiMemoryClinic.com. Thank you very much for watching and sharing today.
Hey,
Thank
can I say something real quick?
Please.
Sure. So I'm going to use myself as an example. That you saw those pictures of all those various plant-based products that Miley has accumulated for us. My cholesterol level used to be about 235, my total. And the doctors were saying, you know, you're going to start taking a statin, Harding. And I went, well, let me try to do this natural. So I got together with Dr. Blake, and he's been working on me probably a couple of years now. It's been a slow change for me. I was a meat and potatoes kind of guy growing up on the mainland, and I had to slowly change my diet. And, but I've been able to do it. I'm not one of those cold turkey kind of guys. I just had to do it piece by piece, but I have gotten my fat diets down to a respectable number for me. I'm at 196. So I'm under that 200 mark. I don't have to take a statin. And having plant-based alternatives today makes it so much easier. You know, when Dr. Blake became a vegetarian, I think they were eating twigs and leaves. But today they've got some really good stuff out there. And one more thing I want to tell you about is this Brain and Body Food that he has here. I've always taken a supplement for many years of my life. And I really just would buy whatever is the cheapest I could find. That's kind of how I am. And then one day I was talking with Dr. Blake, and he said, you know, turn that label around and look to see what's in it. And come to find out the vitamin E in this multivitamin I was taking was synthetic. And I discovered the more I looked into it, the cheaper vitamins are using synthetic forms, which just don't work well with the body. So I converted to the Brain and Body Food some time ago. And I noticed within 2 weeks, my energy levels had risen. And if you're looking for a good vitamin that is full of natural organic supplement ingredients, this is the one I take myself.
I take it too. Yeah, we've got to keep our brain sharp over here, and it all helps. The antioxidants help too.
Oh, goodness, this has been fascinating. I have questions written down here. One of the questions that popped into my head is, a lot of times we hear about hereditary cholesterol and I guess dietary impacted cholesterol. How does a diet affect what the physicians are calling hereditary cholesterol?
Well, it reduces it. And you see some people who maybe if you have a tendency toward high cholesterol because of your genes, then your cholesterol, when you go see your doctor, might be something like 240 total cholesterol, you know, or an LDL of 200. But if you adjust your saturated fat in your diet, then maybe it'll go down to 200. And that would be a tremendous break for your brain and for your arteries and for reduce your risk of heart attack. If you have hereditarily low blood cholesterol, you might go to your doctor with a 230 because if you're eating a lot of saturated fat, like that guy was eating 68 grams a day. And then when you lower it, all of a sudden you're getting down. And if you can get it down under 200, that's good. If you get it under 180, that's fantastic. And sometimes total cholesterol can even inch down toward 150, which is in the Framingham study, the heart attack proof zone. Frankly, I think it's almost impossible to get there without drugs, but I'm still working on it. I'm somewhere in my 160s and trying at least, going in the right direction, let's say. So it doesn't make that much of a difference whether your genes are saying high or low cholesterol. The point is, if you're not eating cholesterol, if you're not eating too much saturated fat, then all of a sudden your body can recover from that. You can think more clearly.
Question that came in is what foods other than meat have are good sources for vitamin B12?
Well, one of the reasons I take the Brain and Body food is because it has just a perfect form and amount of vitamin B12. And by the way, you know why meat is a good source of vitamin B12? It's because they give it to the cows.
Really?
Yes. However, when you look at meat, what I think of is dramatically higher risk of colorectal cancer. Now, raise your hand if you want more risk of colorectal cancer. No hands are going to be raised there. It's really scary when you look at the side effects of eating meat. So vitamin B12 can be gotten with supplements or with fortified foods that don't contain animal products. And surprisingly, in clinical low vitamin B12 situations, most of the people are eating plenty of meat but can't absorb their vitamin B12. And just for reasons of stomach acid and intrinsic factor and other reasons like that. So my feeling is that a supplement of vitamin B12 is extremely safe. There's no upper limit. It is extremely cheap. We're talking pennies a day. And that there's no reason why everyone shouldn't supplement with vitamin B12 as a little insurance policy. What kind of insurance can you get for 5 cents a day?
It's true. Here's an interesting one. In Hawaii, we eat lots of deep fried foods. Many Oriental foods are deep fried, tempura, different things. Would using olive oil to cook deep fried foods be a better choice, or does it make any real difference?
Well, deep fried foods, by kind of definition, you're going to take an oil and heat it up to the point where it's going to go rancid. And rancid oils are a problem because they increase certain long chemical names in the body that lead to cancer. Malondialdehyde causing DNA adducts, for instance. So it's probably a good idea. And I know that deep fried foods are very common as fast foods. In every fast food chain likes to have deep fried foods. The food cooks very quickly, it's delicious, it's very satisfying, but usually very high in saturated fats and even worse, trans fats when you look at the deep fried foods. So I can't think of a healthy way. Now, olive oil is going to break down in a high heat, and it's going to go rancid. This is why they take, say, soybean oil, and they put it through a hydrogenation process to make it fully hydrogenated so it doesn't go rancid. Unfortunately, that eliminates the essential fatty acids, almost all of the vitamin E, and introduces trans fatty acids, making it very, very unhealthy. So there's not really a healthy way to go deep fried. Sorry about that.
Okay, I guess we could get used to the air fryer, right? Do any of our participants have any questions for either Dr. Harding or Dr. Blake? Okay, I have some others then that came in. Will dietary changes allow a person to reverse damage to the brain?
Absolutely. Absolutely. The damage we're talking about is not the Alzheimer's plaques. They're likely to stay there forever. But it reverses the clogged blood arteries so that you can get better blood flow to your brain, improving memory, improving your ability to learn. And that's really important. Also, with less saturated fat and a few other changes, you can reduce the amount of the formation of Alzheimer's plaque. And when Alzheimer's plaque is first formed, it's amyloid beta. And then it becomes fibrillized and aggregated. And those are very toxic to the brain. Once it actually goes into an Alzheimer's plaque, it's a little quieter. So you can stop a lot of the problems with Alzheimer's disease too. So yes, improvement is possible if a person's willing to change their saturated fat intake, but probably not, except for the worst, if they're not willing to change it.
Question that came in is what foods are good to raise calcium?
Oh, calcium. Well, can I let my wife answer that one? She's so good at this.
Sure.
Hi, everyone. I love sesame. Sesame is higher in calcium than dairy products if you examine it per 100 grams. So I got into making sesame tahini dressings with garlic, sesame tahini, and lemon juice, and a little bit of salt and pepper or tamari. And it's great. It's a topping you can put on vegetables or grains or anything. It's totally delicious and really high in calcium. Various nuts and seeds, grains have calcium in their germ. Beans are pretty good in calcium. So what we do with a whole plant food diet is we supplement our calcium. I know we're not getting it in the dairy like we used to, but so we take it in the brain and body food. There is enough calcium to supplement what we're already getting in our foods. I wanted to answer one more quick question, which was about the deep fried foods. We all grew up with the standard American diet or Asian diets, different diets around here, local diets, Hawaiian style foods. And it is an evolution for us to think about other ways of eating foods that we're used to eating deep fried. So what I've done is I'll put food in a pot with a little bit of water and maybe some seasonings, and I'll cover it. And the food steams really nicely. And then you can put any kind of sauce or topping on it and you're home. You don't miss the deep fried flavor. Thank you.
Thank you, Catherine.
Interesting. In your calcium, is that calcium citrate or carbonate?
The calcium that I use, one of the many books being mentioned that I've wrote is the McGraw-Hill college textbook, Vitamins and Minerals Demystified, and I'm the sole author of that book. So in that, I examined the best forms of supplementary minerals. And for calcium, I chose calcium citrate malate for the 268 milligrams of calcium I put in a daily amount for the brain and body food. And that nicely supplements and tops off a good diet that doesn't have dairy products in it.
Okay. We hear a lot about stress and the effect that it has on the body, including raising cholesterol and doing things like that. How much, if we learn to control stress better, what percentage-wise would you think we could affect the cholesterol level in our blood?
Well, they actually did some tests where they tested people's cholesterol, put them in an elevator, had it then pretend to drop the elevator, you know, and scare the heck out of them, and then retest their cholesterol. The body will make more cholesterol in response to stress because stress hormones are made of cholesterol. So we can up the production of our cholesterol in response to stress. If you're thinking that you can get away with a high saturated fat diet and low stress and get away with that, not a chance. You just can't fight that very unnatural diet. It is not normal for humans to eat so very much saturated fat, and our bodies just can't take it. It results in the biggest killers in the world, especially heart attacks, strokes, diabetes. I have a book on diabetes that talks about the role of saturated fat in that too. And of course, Alzheimer's disease and vascular dementia. Right there are some great reasons for lowering that saturated fat intake. And lower stress is good too.
Could you talk a little bit about, you mentioned avocados as one of the fats that perhaps is, well, definitely is better than any others, but can you overdo it?
Oh yeah, sure. You know, all you have to do is check the notches in your belt if you overdo it. Avocados can be fattening if you overdo it. But avocados, two things. One is they're still a whole food. People say, what about avocado oil? Well, they take a lot out of a food when they make an oil. Take a sunflower seed and you remove most of the vitamin E and all of the fiber and so many good things, and you get sesame oil or sunflower oil. And avocados have fiber, they have vitamin A, they have vitamin C, they are loaded with phytochemicals, they have carotenoids. They have all these protective things in an avocado that you wouldn't get in an oil. Now, if it's unlikely to raise your cholesterol by eating avocados because they fill you up pretty well. But I would say for a sedentary person, half an avocado a day might be a limit. And for an active person, perhaps one avocado a day would be a limit, just so you don't overdo things.
I don't think most of us have an avocado a day.
They're fantastic. We grow them.
Yeah. Oh, because this has been really, really interesting and very helpful. And we deeply appreciate your joining us today. If any of our guests have questions, can they contact you at the Maui Memory Clinic?
Yes, actually for me, steve@drsteveblake.com would be an email address.
Okay.
And Dr. Harding, how can they best contact you?
I'm going to say through Miley at the Maui Memory Clinic.
Okay. So there we have it.
Yeah, just Google Map Maui Memory Clinic and hit the call button and talk to Miley.
Okay. And we'll get Miley. Thank you again so much. And thank you to everyone for joining with us today. Again, my name is Gary. I'm with the Caregiver Foundation, and it's been our privilege and honor to have you join us today. Hope you'll join us again next month.
Bye, Gary.
Bye-bye.
Bye-bye. Thank you.
Third Tuesday of each month.
Thank you very much.
Bye-bye.
It's been a pleasure.